Good day, Raj.
Hi, Rudy. How are you today? You all right?
I'm well. How are you?
I'm fine. And welcome to Broadway Pharmacy, where we're filming this. The team are working pretty hard behind me, so it's really nice for you to be here today. Thank you.
Great. So where exactly are you in South East London?
We're actually in the borough of Bexley and Bexley Heath. The pharmacy is actually located on a busy high street, which is a normal location for a pharmacy. We're right next door at the store, so it's in the middle. It's kind of in the heart of the shopping centre. So there's a lot of traffic between sort of patients and local residents doing their sort of daily shopping and just sort of coming along to get their medicines and things like that.
Excellent. So this dialogue, this community wellness dialogue, which is being led by Community Pharmacists, is what your community pharmacy can do for you. And it's part of a series, which is great. So what are the core services provided by Community Pharmacists?
That's a very interesting question. We're actually contractors that work within a regulatory framework with the NHS. And the heart of this is that we provide three levels of services. They're called essential services, advanced services, and enhanced services. So the essential services are probably what most people are familiar with from community pharmacy, in that we're dispensing, we're providing a safe way of getting the medicines to patients, we're providing self-care, we're providing signposting, and we're providing what's called clinical governance. So what that means is that each pharmacy has to adhere to clinical governance, which is a framework set up by the NHS to ensure safety for the patient. So we operate within that. And within that, we also have something called waste management. So we take back medicines from patients that are no longer used. So we don't want them thrown away within the normal refuse. So if you bring them back to the pharmacy, just bring the tablets back. We don't want labels and things like that. That's patient identifiable material. Just bring back your tablets and we will dispose of them safely within the way it's width. We get rid of them. So they're sent away to a special place to be processed. So that's the core contract that we do. Now, the advanced services are things like new medicine services. So that's when a patient starts new medicines and we walk them through for 2 to 3 weeks with that medicine. So we answer any questions to give them assurance, give them information. So the patient can make an informed decision about why they're taking the medicine, what the condition is, and what the likely beneficial outcomes are for those medicines. So within that advanced service is also the flu vaccination service, and also now some of the COVID services as well. And then we have what we call enhanced services. Now these are services that may be commissioned by the local NHS or the local authority, but the local authority ones are called locally commissioned services. So things like sexual health services, where we're providing emergency hormonal contraception, where we're providing chlamydia testing kits. Even so, we have sort of harm reduction services. We're actually supervising patients when they take their medicines within the pharmacy to help maintain a healthy outcome for them. So those are the full gambit of services, but I think most people are aware of that pharmacies are a place to get your medicines safely and quickly within time. But I think one of the biggest assets of community pharmacy is that we are based in a community and we're convenient and we're accessible. You don't have to book an appointment. You can literally just walk in and have a chat with a healthcare professional who has had a high level of training. The pharmacy course at this moment is 1 year under a pharmacist, what we call the pre-registration year. And at the end of that, they have to sit an exam to pass that before they can qualify as a pharmacist. And only then are they able to actually practice on their own. So in the future, that's going to change, and we'll have the pre-registration year as a foundation year. And what will happen is that foundation year will mean that pharmacists can actually operate in different clinical settings. So they may be in GP surgeries, hospitals, primary care network settings. So the pharmacists at the end of their degree in a few years' time, there'll also be independent prescribers. So you'll see a dramatic change in the way community pharmacies operate in the future.
Thanks for that.
So that's
So,
all what we do.
thanks for that. So what are the specialist services currently being provided by the community pharmacists?
I suppose everybody knows that we're under a pandemic, so the specialist service that many pharmacists are providing at the moment is the COVID vaccination service and being part of the local vaccination sites, the LVS sites. So that's one of the things. And in South East London, we've actually got a COVID champion service where we are encouraging our pharmacy teams to actually engage with the people that walk into a pharmacy and ask them whether they had their vaccine. And if they haven't, and then actually provide them information and assurance to ensure that they actually get the vaccine, to address any concerns that they may have. And also, if we're able to, book them for the vaccine there and then on the national booking site. And this has been a fantastic service, which was commissioned by South East London Clinical Commissioning Group. And it has sort of generated a tremendous high quality data, which suggests that some of the concerns that they're facing are, it's about the risks of blood clotting, just a general lack of understanding what the vaccine is and what the vaccine process is. Some people are sort of waiting to see what the effects are. There's a bit of hesitancy there. But on the whole, it's just a case of they just require a bit more information, just a bit more hand-holding to get them across the line to get the vaccination. So some of these are specialist service. We also provide sort of flu vaccination service, and some of the other services which aren't covered by the NHS are like travel vaccinations and also like PCR testing for travel or even lateral flow testing for travel. So these are some of the specialist services that you may get in your pharmacy. I know some pharmacies also offer a weight management service, which is quite good. And in a pharmacy that I work here, we also offer a mold detection service. So we're able to take a photograph of the mold and send it away for it to be analysed. So you'll find that pharmacy is evolving to a more clinically service orientated. But what we will have is we'll always have the dispensing of medicines, which is the core service. And what we will intend to do is to sort of bolt on all the specialist service to our core function, which is making sure that the patient gets the medicines safely and promptly.
And I know, going back to the vaccine, in terms of some people who are not sure about their status, so they can always go into their local community pharmacy in complete confidence, because obviously everyone's entitled to take the vaccine regardless of their immigration status.
Oh, you're absolutely right. We do not check anything like that. What we really are, we're healthcare professionals. We're just interested in the health and well-being of the individual in front of us. So all that, I think, it's not, we just want to ensure that that individual gets access to the healthcare that they need at that time.
Yes, it's about public health. Thanks for that. So how do community pharmacies work with their local CCGs? You've touched on that, the primary care networks, the GPs, the social prescribers. You've mentioned community champions, voluntary groups, community group and faith organizations, all who have a great interest in the health of their local populations.
So community pharmacies have a single entity called the Local Pharmaceutical Committee, which covers the whole borough, and the LPC, as we call it, is the focal point. And what we're doing is we're developing an infrastructure in place using the primary care network lead. So we have a community pharmacy primary care network lead in each of the primary care networks, the PCNs. So these are our sort of eyes and ears on the ground, and they feed up information to us, to the LPC board or committee, and then we engage with the South East London Clinical Commissioning Group and also the ICS as it's maturing now. South East London probably has is a bit more forward within its maturity of the ICS, and we have been engaged with the chair of the ICS and also the accounting officer of the ICS to ensure that community pharmacy is well integrated. Working with GPs, you'll find that every community pharmacist has a good working relationship with their GP, which has now improved even more because we've got practice pharmacists working within GP surgeries. So that rapport between fellow professionals is building bridges that weren't there before. I mean, yes, we would work with our colleagues in general practice, but obviously they are extremely busy with what they're doing. So having a practice pharmacy and a GP surgery is fantastic for us as well. So there's a natural bond between our fellow professionals, which we used for the better outcomes for our patients. So that's how we're working with those. And obviously we're using our relationships as an LPC with the ICS and CCG to develop services. I mean, such as the community wellness dialogues is fantastic. It is helping us provide the outreach that we do. You've got to understand that community pharmacies are based in their communities, and much of the workforce comes from a local area. So they have a fantastic rapport with the customers and the individuals that walk into the pharmacy because they're from the local area. They understand what the needs are of the individual. So you have a natural bond between the community pharmacy and the community. And you tend to find that community pharmacies are what we call anchor sites. Mm-hmm. So within the localities, especially in what we call secondary parades, mm-hmm. where the post offices are kind of gone now. The pharmacy is a kind of an anchor which keeps that local parade alive.
Yeah, it provides the footfall for the area, doesn't it?
Absolutely, and that ensures that local parade, the local convenience store, is still sort of there as well, and that means that that local community is still thriving around that sort of secondary parade.
Right. Well, that's great. So, Raj, if you could finally, before we go, just remind us of your regional role, your title, etc.
Okay. My name is Raj Matharu. I am the chair of Pharmacy London, which is a federation of 12 London LPCs. I'm the chief officer of Bexley, Bromley, Greenwich Local Pharmaceutical Committee, and also Lewisham, Southwark, Lambeth Local Pharmaceutical Committee. And these are representative organisations to ensure that we represent community pharmacy at all levels, from what we call neighbourhood with primary care networks, place at borough level, system across the ICS, and region across London.
And now, of course, you're leading on the community wellness dialogues, which provide the community pharmacy with a strategy for getting involved in the local communities and contributing to representation across the ICSs.
This for me has been extremely brilliant sort of initiative that we've engaged with the CCG and yourself, because I think part of the remit of community pharmacy is healthy living pharmacies. So this is an active engagement with our cohort of people that walk into our pharmacies to provide them the agenda of prevention, the prevention agenda. We need to make sure that our communities are healthy and well, and that fits in with this, dovetails into this beautifully, because it allows us to actually go out into sort of local churches, local temples, a lot of mosques. And I've also gone in and presented to, we have sort of healthcare groups that meet up, like the local diabetes group or the Breathe Right group for sort of COPD and asthma patients. I mean, I have presented at the local Bexley diabetes group. It's an opportunity for pharmacists to actually get out of the pharmacy and actually meet patients in an environment that they feel safe in. So it allows them to ask the questions that they need to. And it's a fantastic way to engage with patients. It really is. I really quite enjoy that.
And of course, the community wellness dialogues, again, will be part of the engagement strategy as it relates to maternity and pregnant women, and, you know, them getting more information, advice. And
one of the one of the things that the COVID Champion service highlighted was in one of the reasons for hesitancy was pregnancy and also fertility. And I think the community wellness dialogues have really allowed us to address those when we go and talk to engage with sort of individuals and residents in one-to-one meetings. So I think we've actually kind of engaged with the CCG at a level, and the CCG is very receptive to what we have to say and the solutions that we are providing them to sort of help with informing our population, because after all, primary care networks is all about delivering population health care. And I think the CCG recognises that this is a tool that they can use, the community wellness dialogues is a tool that they can use to actually deliver that population level healthcare. And I think we need to expand on that. And obviously that will really mean having dialogues with our commissioners as well as our customers and patients. Yes,
and of course the local maternity units and services as well. And given the whole Better Birth program that the services are involved with, which is very much about community services. So again, you can see some great health outcomes for women and children in the long run.
Oh, absolutely. I think that's one of the beauties of being a community pharmacy, is that you are actually present because we deal with generations.
Yes.
You know, so you'll be dealing with sort of grandparents, their parents, and children. So community pharmacy provides us a life course of care at all times. So whether we're dispensing prescriptions for sort of milks for children, all the way up to providing, as I showed earlier, sort of what we call dosset boxes for people who can't really sort of manage the medicines on their own. So we're providing them with a solution for them. So it is across the whole life course that we provide services, and you do tend to find that because community pharmacies are readily available in the community, it is an opportunity for everybody to just walk in and get their advice there and then. And you do tend to find that most times the community pharmacy will answer your question within about 5 minutes. So there's not a wait.
Which is great, because again, as demonstrated, community pharmacies can provide public health solutions at system, community, neighborhood, and individual level. And increasingly population groups as well, which is really important, that we do recognize people, their dignity and respect in terms of their population groups and the culture. And this cultural understanding is so important.
Absolutely. And I think also many community pharmacies deliver medicines to their patients as a goodwill gesture. This is not something that's funded by the NHS, but over the years you develop a relationship with the patient, and you think, this patient has been with us so long, we find it very difficult to sort of not to give that level of service to them. And also at that time, our drivers are addressing sort of social isolation. So many of these individuals tend to be sort of socially isolated within their communities, and our drivers and our pharmacists, even by calling them up and saying, "Do you want your medicines?" gives them an opportunity to engage in a conversation with an individual. So it's quite a diverse portfolio that we provide for our patients. And I think as we move forward, with the onset of online and sort of digital technology, I really want to base that relationship on the pharmacist and the patient. I think that's key to the success of community pharmacy as we go forward. Yes, digital has a place, and that face-to-face relationships is key to the health and well-being of our cohort of community pharmacy patients and customers.
And in terms of local care homes and other similar establishment, what is the relationship and role for community pharmacies within those particular settings?
Okay, you do tend to find that care homes will supply their medicines for one particular pharmacy. So they have a sort of a business relationship between that care home and that pharmacy. And that pharmacy will provide a holistic service to that home. They will provide all the medicines needs. They deliver the medicines to them. They will review some of the medications. And generally what they do is they ensure that that medicine gets to the patient on time, and it's in a form that can be given to the patient and help with the sort of administration of that. So they might provide what we call MAR charts and charts, which allows the carers to give the medicines, or they may, in some situations, depending on the need, provide medicines in what we call the dosset box, the MDS trays. So that relationship is key. And you'll see another development. So some of the local borough teams have care home pharmacists. So they go in to look after patients, and they liaison with community pharmacists quite close. So you've got that sort of professional link happening again. So there's a lot of pharmacy needs. I mean, I think over the last 18 months, because of the pandemic, pharmacy has come to the fore. If you talk to commissioners, if you talk to the NHS, you talk to the Ccgs, you will find that the pharmacy teams, whether they're working in community pharmacy, in hospitals, or in Ccgs, or within the NHS, have come to the fore. Because all of a sudden people have realised that during the pandemic, the only place you could get access to a healthcare professional was a community pharmacist. It was really, our doors were open.
Throughout the whole pandemic, as I understand.
We never ever closed. I mean, we did reduce our hours sometimes, or we closed for about half an hour and let the team sort of rest and recover. But other than that, I think all pharmacies are back to normal now. It's business as usual for us now at the moment.
Yeah, and of course, community pharmacy also demonstrates the fact of the workforce is the community, and the community is the workforce.
Absolutely. Like I said earlier, these guys work in the local community. They are from that community, and their rapport and the dialogue that they have with our customers and patients is second to none. I mean, I can see there's cards around here with thank yous from our patients and customers, thanking the team for what a wonderful job they did during the pandemic. It's really appreciated. And I've lost count of the times we've had biscuits and chocolates given to us. So.
Okay, so thank you very much for this community wellness dialogue on what your community pharmacy can do for you. Thank you.
It's been my pleasure, Reggie. Thank you very much.